Good day, everyone, and welcome to the webinar today, Standardizing Healthcare Metrics for Success. My name is Russell Hendrickson. I'm the President and CEO of Practical Data Solutions. Thanks so much for joining us. I'm pleased to have with me today Kim McDaniel, who's a Senior Consultant at LDR Services.
Hi, Russell. Hi, everyone. Thanks for having me.
Excellent. So let's jump right into today's topic, which is standardization of metrics. And so we're going to talk about standardization, how market changes are driving the need for more standardization. What does it mean to be data-driven? How do we go about assembling the governance team that's going to help drive this initiative? What's one way to map success? Some of the challenges you'll hit along the way, and then, of course, the importance of data modeling and staging being successful. So with that, let's jump in and talk about, what is standardization and really why do we need it?
And, standardization is one of those words, you hear it a lot. Right? If we were to define it, we would say it's a way to educate, inform, and measure outcomes. We really need that within our organizations. However, if you really look the term up in Merriam-Webster's definition, you look at the buzzwords, conformity, consistency, quality, value. This is a way for us to put information together so that we can use it and grow with it.
Right. And so leading to that, then, what we're hearing from our customers is really what's been going on in the market, which is we just acquired or merged with another health system. And so now we're going to have multiple billing systems, or, we're part of an organization that's, going multi-state, and we've got different versions of the same system. Or, quite honestly, we're switching over or we're integrating our scheduling with the hospital system. So how do we then handle with all this acquisition change in technology? We've got different systems calculating metrics in different ways, and that's really driving some of the need for standardization, even more so today than ever. So if we think about, an organization that's changing systems, you might want to be able to do something like you see here, where we have, some revenue trends with charges and payments. We've got collection rates. We've got things like appointment status, looking at how many patients have arrived, looking at things like payer mix, and even patient satisfaction data. And most of these are fairly simple metrics, but if you notice at the top here, we've now got a dimension here that allows me to look at what might be, system A, EHR-A, blending data with EHR-B, because we've got multiple states, we've got multiple systems that we're trying to integrate data. And so in order to put two different data sets together on the same page and have them be meaningful, standardization is just a requirement. Otherwise, what you'd have wouldn't make sense. You wouldn't really be measuring things the same way.
And Russell, as I review that on your screen and I look at the revenue trends, I think about charges and then payments and adjustments. And I wonder, they don't always mean the same thing across systems and definitely across organizations. So I'm excited today. We're going to look at an example on that very topic and why they're the same and why they may be different. I'd also like to say the nuances of appointments and that data within a clinic or within a broader organization. Also, the need for standardization, I completely agree, it is necessary.
Okay.
So then if we think about, why do I need to do this? I like things the way they are. Why should I change? Well, because for those of us in healthcare, every day is a new day for us. The change and the pace of the change is at an all-time high. We do hope that every change that we make will help to improve our ability to continue to provide care in the fact of margin improvement, financial measurements. Those are all important, but we need to be able to measure something that is similar to something else that is similar and watch that grow over time. It's also important for us to be flexible and nimble. We're changing daily. Sometimes we're changing monthly. Sometimes we're changing annually. Just depends on what's happening around us. So being nimble and learning from continuous improvement will be important for us. And communication is key. Your leadership, the relationships that you build, as we'll talk about today, who should your relationships be with? That's important because this work is ongoing.
Yeah, and so you touched on continuous improvement, and really the need for standardization isn't about putting a bunch of metrics on a dashboard. It's about using data to gain insight, right? So through gaining insight as to what's going on in an organization, being able to understand, performance, that's how we drive change. And that's really why we need standardization. Ultimately, it's about driving change through the organization.
What do we need to think about at the very beginning? So we thought we'll give you some helpful hints to keep in mind before you begin creating a roadmap. So on the right-hand side, you'll see a group of dot clusters, different colors. That may be how you're feeling, right? I have all of this data. Each one of those dots and the colors associated with them will represent different data elements. Some may be charges, some may be payments, some may be visits. And those colors can begin to create themes for you. Are they financial metrics? Are they clinical metrics? Do we measure them operationally? There is no guarantee in your clinic, if you use one system, that everything is built the same way and used the same way. And so we want to be able to start thinking about what that looks like. And I can't stress this enough. Listening is your superpower. Your ability to listen and to understand what your executives, what your team challenges that you're facing, those types of metrics, those types of initiatives will help you build your standardization. Also, this is not an independent exercise. Brainstorming is your key to also creating achievable goals that you can set and celebrate with your team. So remember, don't suffer in silence. Bring others into the mix and listen and create some kind of momentum together. It will bode well for you. And lastly, probably the most important thing, perfection is not what you're looking for. You're looking for progress. Progress to keep moving forward and create the momentum that you need to be successful. And if we think about like a mantra for that work, we think about Henry Ford, right? Many of us drive cars, have cars, some of us lease cars, buy cars. It doesn't matter. We're all moving forward with that. But this quote was from 1926, and it says, if you think of standardization as the best that you know today, but which is to be improved tomorrow, you get somewhere. So no car is perfect. No standardization efforts may be perfect at first, but definitely data and the progress is what we're looking for in that data.
Excellent. So let's look at an example, kind of dig into a little case study here. You talked about starting small. Here we're looking at some, fairly simple patient access metrics, looking at things like appointment visits by day of the week, broken down into AM and PM. We've got some scheduling utilization metrics. What is the physician's booked schedule versus the available schedule? I'm going to skip right over third next, Kim. I know how much you love that metric there. We've got some visit type categories. Arrived, canceled, no-show, bumps. Seems fairly simple. We've got 4 categories. And then over here we have, a little bit of, different levels of detail. So in terms of starting small, to me, this looks like a fairly simple dashboard. So talk a little bit about how we might apply that to, starting the process. Because, I see a handful of metrics here. They don't seem too complex to me.
Well, they don't at first until you start digging into it. So we talked about the importance of a roadmap. Now let's talk about how do we create a roadmap. So we're going to create an inventory. You say, what does that mean? So on the right-hand side with those dot clusters, you'll see the funnel appear. Those dot clusters are going to start to make sense to you as you socialize your message, as you bring information together from all of your systems. You're going to start documenting that information. So think big, start small, develop the plan, and move it forward. Socialize this work. Bring others together. The organization may be doing this work in a different sector. If that's the case, start asking questions. Think about those measures that feed that larger metrics. And how do you bring a successful group together? Governance. Governance is the key to success. It creates limitless thinking. So we all are skilled in one thing or another. That's our lead skill. It's like your senses. And so when you create a governance with mix of people who have different roles and different responsibility, it can create that kind of thinking that you need. And then tracking organization is key. You must track your progress, your decisions, so that you can keep moving forward and keep creating that success.
So Kim, to dig into a little bit of the importance of creating governance, in a smaller, say, physician-owned practice, it's usually fairly easy to identify who are sort of the key roles. We need somebody from finance, somebody from operations, and usually the leadership team plays a key role in governance. But how would you go about assembling, or what recommendations do you have about, building a governance team in a larger organization where maybe, you've got competing priorities, you've got larger departments and staffing, and you may even have some people that don't see the value to that?
Sure. And I think that's a good point. It is definitely a sliding scale. But what you'll find is that each person represented in each of these functions, IT is almost always necessary. Someone from finance almost always necessary. But whether you're a larger or a small group, think about the particular focus. Think about the metrics that you know are challenging, that are causing your team a lot of work, and what you've heard from some other folks around your organization. Start to put those together. Each person will serve a particular focus area on your team. However, their skill sets can cross multiple areas. So for example, there is a person on your team that has been promoted to a functional group on a different team. That person is valuable to governance because they can help using two different skills, one being their lead skill where they are right now, but the other, the function of where they've come from. And so you can create dynamic that's well beyond any of these functional areas. And that is represented by the different color boxes. So let's build on that. And let's think about each metric with a specific focus. Where does it belong? One of those buckets may be financial. One of those may be clinical. It takes the clinical folks. Think about the feedback that you've been receiving as you're building those metrics. So see, those colored dots now have a funnel, and now each of them are becoming more visible in their respective areas. Remember, the governance team that you have, they're your advocates. You're not doing this alone. You're doing this with a group of smart, capable people who can be an extension of the work and create a force for the organization. Remember, they're going to define, socialize, and help you celebrate to continue the efforts with these metrics. Now, specifically notice the bottom portion and look where people are looking. It's not lost on me. The colors of the sweaters and the colors of the dots are in line, but look, some of those folks are looking backwards. What does that mean? It means that they can help you. This is a visual example of them helping you socialize that message and your team continuing to celebrate the success.
And, so as we think about it, and I think that's a great explanation, trying to understand governance and then standardization of metrics, so we start to now define, we work through from, starting with some of the easier metrics, right? It's an ongoing process, as you've talked about. Ultimately, what we're trying to do, though, is drive, being a data-driven organization. You hear that term today, it's become very popular again. But governance is really the way you're going to lead your organization to be data-driven. Because data-driven organizations, the focus is on using data, but we can't just use any data. We have to have standardization in metrics to be able to make the data meaningful. And then, through that, we can see opportunities as we measure across different areas and across different standards of metrics. We start to identify what are performance gaps. And ultimately then, as an organization, leadership leading, but the organization as a whole can use the insights from the data and these standardized metrics to improve performance. So let's go back and take a look at our patient access dashboard. And I've changed to another tab here where we went from just looking at what's happening right? This is what's happening across the organization. But now we want to actually start to project or predict, what if we could improve? We see performance gaps. And so in this case, looking at the scheduling data, we could start to ask the questions, if those physicians that aren't performing at the division average of number of visits per session were to improve their performance, potentially how much money could we see an increase? If we want to look at it as dollars, if we want to look at it operationally, we might be able to say we have more capacity. We might be able to see 20 more physicians per day. Or if we want to set benchmarks or budgets or targets as part of our standardization, we can start to calculate that. So as we look across different areas of our organization, as we look across different divisions, we can start to quantify the potential opportunity, because our standardization allows us to then measure where there are opportunities, the potential ROI of that opportunity, which may be theoretical, but even if we could yield half or just improve the quality of our care by being able to see more patients. And so this is just one example of how that can allow us to use data and standardization, because we can now quantify performance and performance opportunities.
And I like the way this slide presents, because it really, if we talk about the providers for a second, so the providers are really touching the entire process. There's a magnitude of information available. So if we start focusing in specific areas for improvement, and we can start building standardization in the form of categories. We don't have to do it all right now. We can do it in categories. Those categories will then serve for education and a little bit more focus on the things that matter. Because at the end, this is a non-punitive relationship building exercise for your clinics and for your providers and everyone within it. The goal is to provide information to enhance performance, not to penalize them for the performance. So never underestimate the relationship building that comes and the trust that will be built as you think about taking smaller categories and creating that standardization to improve performance and to drive that revenue potential.
Yeah, one of my colleagues here all the time says we're trying to shed light. We're not trying necessarily to shed heat, right? So uncovering opportunities. So, thinking forward just a little bit, and what we see changes going on in the market, and what we see with some payment reform and some of the things going on with the CMS and in Congress. When we think about scheduling data, we think about patient access. If we can't do some of these standard metrics, if we don't start down this path, we cannot get to the more complex things. And so what you're looking at right here now is, if we want to model out compensation, physician compensation, and the reason we would want to model it out is because of the changes, whether it's, more pay for performance, incentives of care, Medicare Advantage plans. If we can't at least focus in and measure what each physician is doing and how they're performing, we can't get to the point of being able to model out or understand, how is our comp plan? Is it fair? Is it equitable? In today's market, even physicians have become very competitive employees to hire. So if we can't understand what's going on in our organization and quickly start to understand how we're performing, because we don't have any standards, we can't get to the harder things. And this is definitely, it's a current trend here we're seeing in the healthcare market, but it's definitely going to be a trend that we see even more so in 2024. So just another little case study example of where we're headed.
Let's continue down our roadmap. You may see this as a long and winding road. How will I start at the beginning and make it to the end? Well, you can. And you can because you're not one, but part of a team, and you're going to create a communication plan. So that plan is going to use governance as your advocate and your team as your bench strength. And you're going to be organized. So you're going to create a glossary, definitions, how you're going to measure those definitions. Again, you're doing that all together and measuring your progress along the way, especially as you walk the points on that road. You'll become more and more comfortable with the confidence, and you'll develop that confidence with yourself, your team, and your extended partners to be able to measure that progress and keep going towards completing it. Even if it's not really the way you wanted it to be, because something has changed federally or organizationally that will create some of that noise towards the progress. Reporting sounds like a really easy word, but it's not always easy. If you understand how you're going to measure it and you talk to your group, then between that and the glossary, you'll start to see that reporting and you'll be able to kind of drive it behind the scenes while you're delivering the definitions of those metrics. Build in review and revisions. Successes are easy to measure. Challenges and stumbles are still a success because the learning that takes place there will be immeasurable. And the more people who understand the changes and the challenges and how to change those into success, meaning deliverable, measurable successes, it'll be invaluable.
Yeah, so Kim, I've had and I'll use the word pleasure working with you, but I say the pleasure working with you on standardization for many years now. And so, reporting, right? Reporting challenges when we talk about standardization and then lessons learned. And so let's dig into that just a little deeper with, if we have to align data. And, what's interesting is even within the same EHR, you may find that different departments or divisions have different sets of metrics. And, we go back to scheduling in particular. As many different schedules as you have, if you don't have good standardization, you may have different visit types. But, what we've learned and what you need to keep in mind is when you think about putting, two different systems together, as you can see by the example here, some things do fit in the box, but a lot of things don't. And in some cases, things may break. So in terms of reporting, and where do we start? Let's start with, what are some of the things that line up easy? What are some of the things that line up, but you got to do some work? And what are some of the things that, no matter how hard you try, they may never line up, or the effort may not be worth the result to get them to line up? So let's start with some things that line up easy.
Yeah, let's talk about easy. That's another word. That's another one of those buzzwords that you're like, if you find it, run with it. So you may look at this list and you think NPI, place of service, procedure and diagnosis. Most are government regulations. They're available on a quarter or an annual basis. You can data load those tables into your systems. Denial codes, they are published. The way you use them may not be consistent, but you can continue to embark on that work because you know that they are not consistent, and that knowledge is power. Another example, probably one of my favorites of all time, it's been 15 plus years in the making, self-pay. Everybody says start with self-pay. Well, you can, but you have to remember that each system could be self-pay, SP, self-pay with a hyphen or without a hyphen, or just plain self. So while they're easy, there's still tricky challenges along the way. So keep those in mind as you're moving forward. But these are considered the easier of the metrics.
Some of the easier things to line up, certainly. So let's look at some things that sound like they line up, but maybe they don't completely line up. Things like RVUs, payments and adjustments, AR, bad debt, even posting periods, things like visits or encounters, they sound similar, but, in my example here, they're apples and, two different types of apples. So they don't really line up.
Well, I would agree. At least you're all fruit. Sometimes it's apples and cars. So sometimes you're not even fruit at all. You're two completely different and separate entities. So RVUs, multiple different kinds, multiple different ways, multiple different dates based on those values. So even though they are regulated tables, they're going to be used differently across many of your systems. Payments and adjustments we're going to talk about in a bit. Bad debt, some have it, some move it out. Not at all comparable in every case. Aging of your AR, increments versus periods. Visits and encounters, we've talked about this before. Some have it, some don't. Some are used differently, some aren't. So while they seem to inherently match up, they sure don't. So let's talk a little bit about those that don't line up unless we touch them. And so if the easy ones are easy, these are a little bit more challenging, but not impossible. We have lots of case studies on successes. Payers and plans, they're difficult to begin, but you have to think about starting small. Just start with small categories and move forward. Locations. Locations vary by systems because not all clinics are created equal, especially in a large system. And so you may need an advanced project that is outside, it's on your inventory, but it kind of sits outside, and you need to review some of those differences outside so that you know when you're meeting with your governance team, you'll know what that looks like and how you can kind of talk through those differences and come to something more synergistic. So patients, PHI and date of birth and social security number and names, we don't really use that anymore. So if we think about how do we put patients together, probably not as easy as you think. It sounds easy when you say it, but not when you get to do the research right away. Payments and adjustments by system, by clinic, we've talked about that. We'll do a little case study on that, about why that's different and why we have to keep talking about it. And then denial reason codes. Denial reason codes maybe roll into categories. So be intentional about that, but can be difficult, but again, not impossible. General ledger, that speaks for itself. It can change and often does over time. And then visit types. Some systems just let you build them. There's no accountability. You need it, you add it, you move on. And so really understanding that information, try and map it up, map it out, what needs to be done first before you actually bring it into your standardization and timeline for your inventory.
Yeah, and I'll make a little comment in here. In some cases where you can't map every single payer or plan, certainly you can try to map payer categories. If you can't map every location, which usually locations you may be able to map location categories fairly easily. So a lot of times as an initial step would be to focus in on mapping categories before you try to map every single potential data point.
That's a great point. Thanks, Russell. All right, so let's talk about payments and adjustments. Gosh, they sound easy and they look so tidy, but look at your systems when you first start. If you have one system, look at it at the category level. If you have multiple systems, try and get as close as you can to that inventory so you know what the system is and how those dollars flow. And then virtually your customers in finance and in revenue cycle and sometimes in operations, they're going to really understand the power in the payment and adjustment metric. So they're your governance team. Ask them for feedback. Where do they struggle? Where are they seeing issues? How do you put a team together of experts? You talk to them, you gather feedback, and then you ask them, don't they want to participate on your awesome governance team? Because it will be a very good use of their time and your time in learning. And then, can't say it enough, audit, audit, audit. Audit and keep a trail for your team. It will serve as the documentation for this effort, and it'll be well worth your time. And then once you have kind of some ideas and you want to move forward, socialize them. Your governance can also help you do that. Just get those findings approved, what you're seeing. Everyone agrees. Most people agree. Remember, progress over perfection. You may not get everybody to agree, but at least those that do not agree will accept progress in that effort. So think about how do you take those findings and then build them into your metrics for reporting. Showcase them at your governance meeting. Build them on the fly and change them. PDS has tools available that can create that visual on a shared, on any kind of a shared meeting. You can start to mix and match and create those reports. And then probably the most important thing, this is hard work. It sounds easy because it's like 5 easy steps to do this, or these 10 things you should work on. Remember to celebrate those successes, because even if you learn something, that is a success and it will create a better output for your future work.
Yeah. So Kim, I'm going to ask you a question here. In terms of assembling governance, was it more common when you were leading these kind of initiatives? Would you bring other members into the governance meetings, or would you just have sub meetings and bring in sort of content experts, like taking payments and adjustments as your example here?
We would bring in actual governance folks, and then we would have a subgroup that would meet where these folks would actually help us deliver that message. So we started small with subject matter experts that were responsible for being our partner going forward, and then those smaller teams would then become kind of the idea mill where we would document that outcome and then build a prototype for moving forward.
Sure. Great. Yeah, that makes a lot of sense. So as we think about this, I want to jump back a second and let's talk then. We started with this example where we showed, blended data from two different systems, and some of the easy metrics, as we were just talking about, even things like charges, payments, and adjustments can be challenging. So if we're using this kind of incremental step process and we may not have everything blended, is it okay? Kim, what's your recommendation on sort of sharing, data? Should we wait until everything lines up so we can say as of January 1st or as of our fiscal year, everything's lined up? What's your recommendations on how are we measuring and sharing things when we're still migrating to more standardization across more metrics?
My experience tells me that your leadership and your governance team, they are well plugged into the importance of the metrics of some of these standardized areas. And so listen to them. And I think it is perfectly fine if everyone agrees that this is going to be a mid-year change, as long as it is approved by your leadership and your governance and it is confirmed with them. And consider your users in that mix. I think it is perfectly fine to change them when it is time to be changed. Sometimes they may ask you to wait to the new fiscal year or the calendar year. But if this is a metrics that is going to help evolve quickly, then a mid-year change could be something that would be beneficial to all of you.
Okay. So let's talk about things that require calculation.
Let's do. These are much more complex. So let's think about your collection rate, net collection rate, gross collection rate. Bad debt is kind of part of your issue, but then look back periods, multiple calculations. So think about numerator and denominator. Think about what's important to you. If you can get a numerator standardized and then your denominator standardized, then this one may be. But it's a little bit back and forth on these, and these will be some of your more difficult metrics to accomplish. Scheduling and utilization, given the variety and how applications use this information, it can be very difficult, and you may have to do it a few times until you can get that to work correctly. We've talked about RVUs and the challenges within those RVUs. For denials and clean claim rate, this is a really good one because you have matched dollars and unmatched dollars and other information that comes in captured with the denial. We talked about those categories earlier, the importance of taking reason codes and categories and dollars. So this one becomes challenging because there's a variety of ways you can look at it. And maybe your standardization efforts will result in 2 ways to do this or 3 ways. And that's okay as long as each one of those has a set of definitions, reporting metrics, and clear communication and documentation on how that looks. And then days in AR, this sounds like easy, right? Just like, what's your AR? Here's your days. But those calculations changed. You can have an audit issue between your beginning and ending AR. You could be inconsistent across systems and not know it unless you're looking at it. So these are ones that we don't recommend you start with, but that you consider as you're building that inventory because they will be important to you and they will serve you well in the future.
Yeah, Kim, you mentioned, multiple ways to do things. I think fairly common, probably half our customers today have 2 different sets of calculations for RVUs. And in some cases, some have 3. So it's not uncommon to have, current year RVUs, which are just the current CMS RVUs in that calendar year. You might then have another set of RVUs that is, picks a standard year like 2022 or 2021, and then is measuring forward activity. So we have a benchmark of how, when CMS changes, we can measure apples to apples, in this case with RVUs. And then not uncommon, very common, having a different set of RVUs even for compensation, and what is common in some of the compensation contracts. So standardization doesn't necessarily mean one way. It may mean we have to have multiple ways to serve different needs across the organization. Going forward to that, we can't really talk about calculating data and calculating custom metrics without thinking about how we stage things. You have all these different data points. Kim, I know you were going to ask the question, well, how do we do this? And my answer is we just have this button. We just press a button and everything gets lined up, right?
I'm going to buy that button.
Yeah, if only it were that easy. But before I explain how we do that, let's dig into another little case example here. Look at a visual dashboard. This is denial data that has been standardized across a number of different data sets. And so, starting off at the top, we have things like, division charges by division, charges by payer category, denied charges by payer, sort of sorted by largest payer. We have claims recovery rate, what percentage of denials are being recovered. We have standardized categories that roll denials to likely source. Okay, so that's something that would be done through our standardization efforts. We've got standards across our procedure categories, so we can look at different code sets. So just in terms of layout within this dashboard, we're looking at a number of different sets of metrics that have been standardized through our standardization efforts.
And if someone asked me, when I look at this, what do I see? And I would say, this is an example of thinking big, right? Thinking big, it's very comprehensive. It's got a wide audience, and it utilizes a lot of sections for change management. But in our mantra of starting small, think about the work that is involved in developing this grid. So just think categories for a minute. Categories like a division. Sounds easy, right? This division. But then when you start layering in your other clinics or your other systems, they don't line up. So think about, I'm going to do, if you like this end stage and you think, what is it going to take? So start with division, then start with denials and your categories. And then start to layer in work like payers, those things where the dollars and the outcomes in your reporting are leading you down that road. This is your change management time. Knowing that this is your end state and taking the small steps forward will help.
Yeah. So let's tie this down a little more and tie this together. So we have our standardization. So now we can start to look at things in simplified categories that roll up. We know we've got good definitions. So now we can start to use the data. Remember, our goal of standardization is ultimately to drive change. And so we can start to use the data to understand where we're seeing lots of denied charges. We can filter through the data very quickly now. We can start to see which payers are causing, high levels of denied charges. And ultimately, we can see, whether it's payer-related rules, patient rules, coding rules, we can start to see where we might have performance gaps. To take it a little further, because we've calculated our metrics, this middle chart here is really doing all the heavy lifting in terms of the complex, where it's measuring when we get a denial from that payer, what is the percentage of time that those denials are recovered. And so if I click right over here, you can see, what the recovery rate is, or in this case, what we haven't recovered. And then ultimately, if those claims are adjudicated, we can see how much was lost. If the claims haven't been adjudicated, we can see how much is at risk, right? So we're really not only using our standardization to make a focused dashboard, but we can start to use this now to identify performance areas, performance opportunities. Maybe we stop working claims that we know we can't recover until we can have some meeting with the payer and try to address the root issue behind it. So we've got data. Our standardization allows us to put it together in a meaningful, sort of simple visual, but ultimately now we can use that and explore that data to identify performance gaps. Going on then, it's not a magic button that allows us to do that. It's really what I call traditional best practice data modeling. And so what you're seeing here is kind of a traditional ETL diagram where data is extracted from the various source systems. We might have other data, though, coming in from our standardization. So based on those definitions, those categories, those roll-ups, if we're mapping data from multiple systems, right? So we may have external data sources. Ultimately, then the logic that creates our standardization is built into these optimized data models. And for those of you who may or may not be familiar, we're using it here at PDS, very popular with star schema or more traditional snowflake schema type designs. So it's through the data modeling that the standardization and the metrics can be integrated. And ultimately, that allows us to then empower whatever analytical software your organization wants to run. So whether it's Microsoft Power BI, Tableau, business objects, Click, it really doesn't matter, because the standardization efforts and the data modeling are allowing the organizations to leverage whatever technology today and even tomorrow you might need. So when we think about standardization and understanding and defining, then we can think about using that data, and ultimately, how do we make it empowered? How do we bring this to the users so you can then ultimately leverage the data to improve your organization?
So now you've told us there's no easy button. We've said
There's no easy button.
There are easy metrics, but there are others that are not, and maybe even some within that easy will be difficult. And now we've said, wow, how or where do I even start? I've heard so much today. Where do I begin, and how do I keep myself motivated? And so you think about people who have been in a similar spot to us. And one of the things that I think of is Michael Jordan. Michael Jordan, one of the greatest of all times in basketball. And he says one way to keep momentum going is to have constantly greater goals. And so I think that sums it up really well. It's progress over perfection. Nothing's really going to be easy, but it's going to be worth it.
Yeah, I like to always say when you think about data and analytics, it's like stairs, right? It's just moving to the next step. So it doesn't matter whether we're on the second step or the fourth step, as long as we keep moving forward and trying to drive greater performance. So with that, to kind of summarize, we talked about having the right team. The governance team is critical to having standardization. If you don't have buy-in from leadership and the other, co-leaders of your organization, and if you can't really come down to a group that is working to the greater good of the organization, even in some cases at the expense of their own, personal needs, just critical, right, to the organization. Having good governance, and of course, being able to communicate, define, and then socialize what you're working on.
And really, organization is the secret to all of this. A successful standardization effort is about organization. Documentation, we all love to do it, but we need it. And so we'll have that. It serves as a process to educate yourself and others and your team. And that socialization, all of these things work together to learn, grow, and evolve, not only you and your team, but also the organization beyond. Reporting and analytics, listen. Your listening is your superpower. Document. Build those reports. Show people. Change them as needed. Keep your end users in mind, because they're the ones who are going to need to know what's out there, how they're going to measure it, how they're going to change it. Continuous improvement. Organizations in healthcare will continue to change. Wouldn't it be great, or can you imagine a world where change doesn't happen until you're finished doing what you're doing right now? It would be great if that were the case, but we need to remember, we need to be nimble. We need to learn from our challenges. We need to celebrate success, and we need to remember that we're going to keep moving forward. Sometimes in your example, Russell, of going up the steps, sometimes we have to go back down the steps, a step or two, but we know that we're going to get to the top of those stairs.
This concludes our webinar today. Certainly want to thank you for coming out and joining us today. And we certainly hope to see you at future events coming up. Certainly, if you want more information from Kim and LDR Services, she's available, as well as if you have any interest in learning more about PDS, please reach out to us as well. Thanks everybody for attending. Have a great day.
Thank you. Have a great one.